SCCM has its own great history and traditions, and in this module we'll review some of the highlights. In 1970, a small group of physicians came to Los Angeles to address the need to bring order to the care of the critically ill, and the seeds for SCCM were planted. The society arose from a growing awareness of the need to have a common meeting ground for multidisciplinary efforts in the fledgling ICU field. A lively debate took place over whether it would be better to regard the practice of critical care medicine exclusively as a specialty or as an area open to all physicians and surgeons responsible for acutely ill patients. We left the meeting without answering this seemingly basic question, said First President Dr. Max Wheel. But a few months later, at a second meeting in Philadelphia, the founding members agreed to form a society with multidisciplinary commitments. We rejected the concept of organizing along national boundaries and agreed that membership was not to be restricted to physicians, but would include nursing, medical scientists, and paramedical specialists, including engineers, technologists, and inhalation therapists. It is the purpose of our society to improve the care of patients, and we commit ourselves to this end by creating a good hospital environment with a qualified team of physicians, nurses, technicians, and medically oriented engineers, said Dr. Wheel in his inaugural address. In a tribute to Dr. Wheel, Bart Chernow, editor-in-chief of the Journal of Critical Care Medicine, wrote, "He saw the need for practice guidelines. He correctly anticipated critical care certification, examinations, the legislative efforts that the society would need to make, and the need for liaison with related organizations." The first annual meeting was held in Los Angeles in 1972. The program intentionally tackled controversial issues, and while the organizers and moderators were founding members, many of the presenters were not, reflecting the society's outreach beyond the original founders. In the 1970s, the idea of critical care medicine as a specialized discipline was a controversial one. Founding members tackled issues like whether to be an elite group and whether to engage in political action. In 1972, under the leadership of second president Dr. Peter Safer, the society launched its official journal, Critical Care Medicine, with William Shoemaker as editor. It was created to serve as an open literary vehicle for discussion of current problems and innovations in the triad of resuscitation, emergency medical care, and intensive care. In a moving statement, Dr. Safer called upon his colleagues in the society to make critical care medicine a demonstration project to prove that human beings are capable of influencing in a positive way the evolution of human life on Earth. In the 1980s, SCCM continued to grow in value and recognition. The American Board of Medical Specialties approved critical care as a subspecialty of internal medicine. The first SCCM specialty section, the pediatrics section, was formed. The first textbook of critical care was published, and the American College of Critical Care Medicine was established to recognize excellence in the field. In 1986, the American Board of Medical Specialties approved a certification of special competence in critical care for the 4 primary boards: anesthesiology, internal medicine, pediatrics, and surgery. It was an exciting year. President Ronald Reagan declared May 25th as Critical Care Awareness Week, stating that patients such as trauma and burn victims, aid victims, and post-operative patients with complications need critical care units within hospitals, and America needs the progress in treatment strategies that these professionals who staff them accomplish. In the 1990s, the American Medical Association offered the society a seat in their House of Delegates. The MCCKAP program was launched, and the first 5 chapters were formed, bringing a local focus to the society. Major research to study workforce requirements was launched, and the society launched its first website. The new century saw the society elect its first female president, Dr. Carolyn Becks. She said that while the first 30 years have been amazing, we can only wonder what the next 30 years hold in store. The possibilities are endless and exciting. In 2002, Maureen Harvey became the first nurse to be elected SCCM president. She said this: "As healthcare professionals, we talk about the legal and ethical aspects of critical care, but we can easily overlook the equally important issue of more humane patient treatment. We need to continually enhance our sensitivity to the ICU experience." While California had proved to be a hospitable home to the society, it became clear that a more central location, close to the many other medical societies, would now be a better home, and the society moved to Illinois. As the nation turned its attention to disaster management, so too did the society hold its first fundamental disaster management course. And to workforce shortages, Medicare and Medicaid challenges, and other issues that caused SCCM to increase its advocacy. But if location changed, philosophy did not. 2003 President Timothy Buckman reiterated the commitment of members of the Society to excellence in patient care. In 2010, the Society elected not only a woman, but a pharmacist, Judy Jacoby, as president, continuing its commitment to a multidisciplinary community. Even this telegraphic glimpse of the history of this society demonstrates the powerful contribution that SCCM is making to patient care and to society at large. There's so much more to be said, but let's move on now by reviewing the highlights of what we've just read. In what city did the first meeting of SCCM take place? Chicago, New York, or Los Angeles? The answer is Los Angeles. Membership in SCCM was originally restricted to physicians. True or false? The answer is false. The concept was slightly controversial in the beginning, but from the beginning, SCCM was committed to representing the multidisciplinary team in the critical care unit. In what decade did SCCM elect its first female, its first pharmacist, and its first nurse as president? The 70s, the 80s, the 90s, or in this century? And the answer is in this century. What was the first specialty section of SCCM? Pediatrics, neurology, or pulmonary radiology? The answer is pediatrics. There's so much more that could be said about the society, but now that we're armed with the context of the association world in which it operates and the very special tradition and context of SCCM itself, let's move on to some of the more difficult issues.